Hi, everybody. Welcome to this webinar on digital social protection innovation for effectiveness. Good morning, good afternoon, good evening. I guess you are all around the world. Sorry for this slight delay. We had some last-minute technical issues. My name is Alicia Spengler, and I'm your moderator today. I'm a technical advisor for social protection at GIZ headquarter, German Development Corporation, and I'm based in Bonn. And it is my pleasure to facilitate this webinar today. In a while, I will introduce you to the two panelists we have today, but just quickly about this webinar series. So this is the fourth webinar of the USP 2030 series, the first series of webinars organized by socialprotection.org in collaboration with the International Policy Center for Inclusive Growth, IPCIG. The objective of the series is to bring together a variety of practitioners and experts to discuss key topics involving universal social protection programs and policies from current state to challenges and opportunities. So there is also an online community which you can also access the previous webinars, the recording of previous webinars, and material related to this series. So please make sure that you join this online community by becoming first a member of socialprotection.org if you're not yet, and then you will find this community. There is a link and you will find it if you go to the search on the platform. This series is also, or will also result in a special edition of the Policy in Focus magazine, which is the IPCIG's flagship publication focused on universal social protection. Contributions to this special issue will come from leading practitioners and experts who are participating as panelists in the USP 2030 webinar series. So the topic of this webinar will show is digital social protection, innovation for effectiveness, as mentioned before. It will showcase the latest innovations, technologies on social protection and how old practices were adapted to achieve more effective results. In the context of the current drive for universal social protection, the panelists will address issues related to the impact of digitalization in social protection systems from design to implementation and risks associated to these developments. Any questions you might have, please make sure to put them in the chat, and we will answer them after the two presentations. So overall, we have a little less than 90 minutes now for this webinar. As mentioned before, two presentations and then the Q&A session. So the two panelists we have today are Tina George, who will present on integrated social information systems, introducing the conceptual framework for digital transformation in achieving universal social protection, and afterwards Mr. Fekadu Hassa, who will take you through the Ethiopian experience with an integrated information systems approach. So Mr. Fekadu Hassa is Information Technology Solutions Technical Support Specialist, working for the Productive Safety Net program, specializing in the field of information technology and geographic information systems. Having by Juris, yes, please the next. Experience in the social protection programs, both in technical and managerial aspects of complex multicultural projects. He has multidisciplinary professional skills. To mention some: social protection, MIS development, system design, database design, spatial data analysis, climate change, carbon accounting in public work activities. Besides, he has experience in program design, training provision, and management of social protection software utility. He fully participates in different social protection platforms, including system building in social protection programs, member of technical group to standardize digitization of social protection systems. He has extensive work experience in information technology advisory in NGOs and government organizations in different positions. Tina George is a senior public sector specialist at the World Bank. Over the past 20 years, she has worked on public service delivery and the implementation of investment project operations and technologies for the poor and vulnerable. Her work focuses on social protection delivery systems, social registries, social safety nets, government-to-person payment systems, foundational identification systems, human-centered design, institutions and governance, the impact of technology on the future of work, and public service delivery platforms serving the poor. Her most recent publication is a source book on the foundations of social protection delivery systems with Casey Lindert and Ines Rodriguez, which is forthcoming, not yet published. She earned a PhD in technology, policy and management at the Technical University Delft in the Netherlands, investigating the design of mobile platforms to deliver services to the poor. So, having said that, a long introduction, I will invite Tina to showcase the conceptual framework to us. So, Tina, please, we are all eager to listen to your presentation.
Thank you so much, and it's such a pleasure to present to this audience. I see that we have 60 people online, and really looking forward to the interactions at the end of the presentation as well. Okay, so let's start with the first slide. So this presentation is actually based on the forthcoming source book on the foundations of social protection delivery systems, which we hope to publish by the end of this year. In the next few months, in fact. So it's almost ready to go. And so that's what this is all about. And it's based on about 3 to 4 years of intense work, compiling all of the good practices and compiling how we've been going about building delivery systems for social protection in a number of countries around the world. So let's just go to the first slide. There's a little bit of a lag, but great. Okay, so let's start with the first, with the first slide here. As we all know, the poor face multiple constraints, and this also reflects the multidimensional facets of poverty. There's low earnings, there's limited assets, low human capital, remoteness, shocks, crime, violence, family challenges, personal challenges. So poverty is not a single dimensional, but it's really a multi-dimensional thing. And so given the diverse needs of the populations, countries offer a variety of programs to various groups along the life cycle. And these programs could include benefits, and these are the boxes in orange, such as conditional cash transfers, unconditional cash transfers, disability benefits, pension, social insurance, or it could be services, such as services for children, youth at risk, counseling, substance abuse, labor and training services for the unemployed, long-term care services for the elderly. So there are really a myriad of benefits and services that are offered to people all along the delivery chain, reflecting these different facets of poverty. So, we really should not be surprised about the fragmentation. If we think about why are programs so fragmented across government, this should not surprise us, and there is a real reason for it. Next slide, please. So even though these different benefits and services seem very different, our understanding from a lot of the analysis that we've done is that they pass through similar implementation phases along what we call a delivery chain. And this delivery chain includes a number of phases, which is assess, enroll, provide, monitor, and manage. And there are some very specific connotations to the colors over here. So the assess is in blue, the enroll is in red, the provide is in green, and the monitor and manage is in purple. And you'll see that as we show the systems that enable the automation of these processes, they all follow the same color codification. So the first bucket is assess. If you think about any program, be it a conditional cash transfer program or a youth at risk program, you would want some form of outreach, to individuals, families, households. There would be some kind of intake and registration, and there would be an assessment of needs and conditions. And we're all familiar with the concept of social registries, which support these processes of registration and determination of needs and conditions by gathering information on all applicants. So at this point, people, that is individuals, families, or households, are potential beneficiaries. They are not beneficiaries already. And this is very important from a terminology perspective. They're applicants at this point. And then if you take any of these programs, the social registry does not tell you that so-and-so is eligible to be enrolled in a specific program, such as a conditional cash transfer, youth at risk. It is the function of the program to make that decision on eligibility. So the program may have their own criteria to include women, pregnant women, or lactating women, etc. And that's how individuals, families, or households might be enrolled. And then there's a determination of the benefits and service package. What exactly does that package look like? And then there's a notification and an onboarding as well. And then we move on to the provision, where the provision is of benefits or services, either in the form of G2P payments, so this is government to person payments, or it could be a service that is being delivered. And the thing about services is that services are really, that whole provision is quite idiosyncratic. It's not something that happens repeatedly as a very structured thing that we see in the cash transfer program. So really the whole provision, monitoring, and management is a much more idiosyncratic process for, let's say, a youth at risk program, to use the same example, than, so there's a lot of high touch. There may be social workers having a lot of touch or contact with individuals or households, as opposed to the cash transfer program. And finally, the monitoring and managing in terms of beneficiary monitoring, then addressing the grievances, compliance monitoring, and exit decisions, because obviously you may not be in a program for your whole life, and then notifications about those decisions and closing cases. And then there's a whole reassessment. Okay, so now there are two major systems involved over here. We already talked about the social registries, but the second major system here are what we call beneficiary operations management systems, or what people mostly understand as MIS, the Management Information System. We've deliberately shied away from the term Management Information System to give it a very functional flavor, which is these systems support beneficiary operations. They're not just managing information. They're supporting the automation and the processes, as well as a lot of data management. And this is where the registries or the databases come into place. Okay, so let's go to the next slide. While that slide is coming up, I'm going to introduce what the slide is to you. So we talked about what that generic delivery chain looked like on the previous slide. And the reason why we're showing you this one is to say that even though you have all of these different programs that might be doing their own forms of intake and registration, doing their forms of eligibility determination and decisions, it makes sense to have an integrated social registry that allows for gateways where you have one place where you do the intake and registration and the assessment of needs and conditions, and it serves multiple programs. And countries are increasingly using social registries not just for social protection to promote inclusion of the poor, but also for programs that are beyond social protection. So let's, for instance, health insurance, emergency assistance, legal services, so on and so forth. To give you an example, and this is a list of all these different countries that are using the social registry in many different ways. To give you an example from the judicial system doesn't have the time or the resources to assess everybody coming through their doors to determine eligibility for pro bono legal services. But if the poor had already registered in the social registry, they may be able to qualify for such services automatically, and the judiciary would be able to rely on the social registry to then determine who to provide those pro bono services to. And that would require some sort of a data sharing, and that data sharing across agencies and programs would need to be carried out in the form of data sharing protocols, which will require standards for personal data protection and security. So now, as we see the social protection, the systems that are enabling social protection programs are not just serving SP, but it starts to go beyond and into a whole of government space, which brings me to the next slide. Okay, so what this slide shows you is that we do not operate in a vacuum with the systems that we build for the SP programs, not in a vacuum for a single program that is a cash transfer program, or have another program that is purely dealing with education focused benefits or a services program. We operate not only as integrated within the social protection space, but also integrated from a whole of government perspective. And that requires an interoperability and a data protection framework that's applicable to whole of government. And so what I mean by that is, if you look at the bar at the bottom, the blue bar at the bottom, there are a number of foundational technology platforms that serve social protection as well as other agencies across government. One is the civil registration system, which tells you whether infants are being born, whether people die, a lot of the different life events that are really important for us to understand what those fluctuations in the population look like. The geographical information systems program that give you a spatial understanding, the foundational ID platform. And here it's important to note that the way we see things, we don't see IDs as being purely national. We see them as being truly foundational, in that nationality no bar. It only proves you are who you say you are. It has nothing more than that. And then the social registry platform that serves different agencies and government, the G2P payments platforms that may serve a variety of G2P needs, not just for social protection. It could be serving, for instance, civil servant salaries, pensions, etc. Or P2G, which is from people making contributions back into government, and this could be the social insurance programs and paying premium, etc. Grievance redress systems, which might be very specific to SP, or it could be national level systems. And then data analytics, and this is where we start to do a lot of data analytics from a whole of government perspective. This is not to say that every government around the world have all these things in place, but in general, we start to see these sorts of patterns emerging, and there are certain good practices in terms of some countries being further ahead in some of these areas and the other countries being further ahead in other areas. Now, this framework underpins what we talked about earlier, which is the social registry that allows you to do registration and assessment. This is the bar in blue on top. And the beneficiary operations management system that enables all of those other processes of enroll, provide, monitor, and manage. Next slide, please. So having said this, we are now moving towards this perspective of governments as being multi-sided service platforms. And what do we mean by that, as being multi-sided service platforms? What we mean is that if you think about any digital platform today, let's say an Uber or a Lyft or an Airbnb, these are what we call digital service platforms that intermediate between service consumers on the one side and service providers on the other side. And in a sense, social registries, if we think about them, are these similar digital platforms or invisible engines that intermediate between people on the one side and government programs or providers on the other side to determine what their needs and conditions are, so programs can determine whether they're eligible for one or more social programs. And when they serve multiple programs, they're essentially acting as what we call a multi-sided service platform. And this comes from the whole body of platform economics with Roche and Tirole and all of these, this whole range of studies that have been conducted in terms of the private sector use of platforms, and now thinking through how governments can use these sorts of ideas of platforms. And if we think about it, foundational IDs are the second part of the equation, which is, are you whom you say you are? And IDs can tell you that, yes, you are indeed Alicia, or you are indeed Fakadu. And then payments, that is, how do we pay you or collect payments, where payments intermediate between individuals, families, households, and all of these different service providers. And these three basic components, social registries, foundational IDs, and payments, to us constitute the fundamental foundational ecosystem-based technologies for social protection. If we have these three components in place, there's a lot that we can do in terms of delivering services, benefits, and services. Okay, let's go to the next slide. I'm almost done. Next slide. Yeah, great. Okay. So having said this, what we also want to talk about is, all right, so we've talked about social registries, IDs, and payments, but what about this beast called MIS, which we prefer to call Beneficiary Operations Management System? Now, one of the aspects to making sure that you can truly build an integrated social information system is to use a microservices architecture approach when you're building all these components, because you don't want to build a huge code base of all these different things that you're going to automate in order to create this MIS, but you want to break it out into these different functional modules to allow for, there are modules for eligibility assessment, benefit service package, conditionalities monitoring, etc., etc. And the more modular we start to make these systems, the better we start to see its applicability, and also the environment in which we can start to think about open source platforms that could enable these functions, so that we don't have to reinvent the wheel over and over and over again in many countries. Okay, next slide. Okay, so integrating these social information systems and following these different approaches, which is having these foundational approaches, then having a microservices architecture approach that you can plug and play different components. All of these have many different benefits. The benefits are for people, for administrators, and for policy planning. And I think you're all very familiar with all of the different benefits from a policy planning perspective. You know who the intended populations are, you profile their needs and characteristics, depending on the data protection privacy perspectives, improving efficiency, better use of public spending, monitoring who receives what, identifying gaps in coverage, duplications, complementarities, so should you receive a combination, a bundling of different services, and what is that bundle that you should ideally receive, facilitating a coordinated response for social programs to crisis that is becoming more adaptive. And then for program administrators, it allows you to have shared resources for intake and registration, so that you don't have all of these different programs going out and doing intake and registration at many different times to exactly the same populations. You knock on the same household's door a number of times. You lower the administrative costs, you improve accuracy, data quality, do all of these different things that contribute to efficiency, transparency, fewer duplications, errors, and facilitating intermediation, referrals, and an integrated case management approach. And finally, for people, this is really a perspective of, this is really a human-centered design perspective, because now we're putting people at the center and saying, we're not building systems sitting in an ivory tower where we know what's best, but really thinking about it from the individuals or the families or the households perspective to say, how many different times are they being contacted? Or, is there one kind of an intake and registration process? Or is there a way to dynamically update their data so that that snapshot of data is not coming from 3 or 5 years ago, and then we're still assessing on that basis? Can they apply for many different programs once with simpler procedures? And can they save costs? Because a lot of those costs involved in journeying to where it is that they're going to provide that data. Access to their data and information, so that they have some self-service as well. We can't just collect all the data and then keep it from an administration perspective, but we need to be able to also share data with individuals, that is their own data, and have consent frameworks. And finally, a more efficient and coordinated public service approach. Next slide, and the last slide. So all of these aspects of integrated social information systems involves some really core requirements. One is institutional and legal aspects. Two is the culture. Three is data integration, and four is political will. Political will we all know about, as long as there's sustained political will, leadership, commitment, ownership. But also there needs to be a culture. That culture of a whole of government approach requires a principle of minimum data collection. That is, we only collect what's needed, and we pull or we have agreements with other institutions if they already have that data available. And data access is for specific authorized use. It's not a dump of data to anyone who wants it or on people's hard drives. And from a data integration perspective, a lot of the protocols need to be in place. There needs to be a framework for interoperability, common data definitions, so that when talking about the same thing across different systems, an ID, APIs, web services, a service-oriented architecture approach, which I talked about earlier, and finally, in terms of institutional and legal aspects, and I cannot emphasize how important this is, we really need to be a lot more considered about how we integrate legal aspects into the way we work. So interagency coordination, clarity of roles and responsibilities, having an authorizing environment, and having a proper legal framework for institutional authority, interoperability, and data protection can solve a lot of the challenges related to integrating, which comes from this fragmentation. So I'm going to end it there and turn it over. Thank you for listening.
Thank you, Tina. That was a very interesting but also dense presentation. I think a lot of information there on few slides. So please, if you have questions to Tina, submit them in the question bar, as we will get back to these questions after the presentation of Fekadu. So now I would like to open the floor for Fekadu Kasa to tell us about the exciting case of Ethiopia. Fekadu, you need to put on your camera. Yeah.
Okay, thank you. I'll share my the Ethiopian experience. Next slide. So I'll try to address the progress made in Ethiopian experience in social protection policy and strategy. Next, I will present the SP programs, different SP programs. Then I will go for the digitalization of social protection systems. Finally, I will raise issues to discuss and the challenges we faced so far. Next. So the Ethiopian social protection has been implemented in fragmented manner, as well as it was lacking coordination between implementing agency, but currently the policy has been developed and the strategy also designed. There is a roadmap. The roadmap, there is a national action plan, as well as there is a roadmap in integrated system development. Principles also have been addressed, like government leadership, community mobilization and participation, gender parity, as well as transparency, are among others. Regarding social protection framework, provision, prevention, transformation, and promotion has been discussed and addressed, as well as institutional framework and arrangements. It is expected to be multi-sectoral role, and there is a social protection council, and the institution or the Ministry of Labor and Social Affairs will take the coordination role. There will be program-based MICs as well. Next. So having said this, I want to discuss on the conceptual model of Ethiopian social protection in MICE, integrated social protection in MICE. This is the roadmap. At the lower level, the platform, there is infrastructure. It's all about infrastructure. The Waradanet is just connecting the lower level of administration to the central level, to the federal. This is all about the connectivity. There is also a platform of national ID and vital registration. This is expected to be work properly, just to implement the integrated social protection system. Next, the registries, the upper side, there is a national household registry. The upper level, there is MICES, different program-based MICES. The colored parts are the areas where the country giving priorities, like the PSNP, Rural Productive Safety Net Program, and the Urban Productive Safety Net Program, given top priority. So the development of the MICE has been started on this area, but we expect the health management information system, the education management information system, and there are different program-based MICs in the middle level. Then there are different stakeholders at the higher level. So each programs will have their own stakeholders and coordinators. At the higher level, we supposed to have the central social protection management information system. Next. So we have 3 layers, as I have said earlier. The National Household Registry, it is a repository or a database of having the poor people data. For the short term, it is social assistance, but in long term, it will be social protection as well. In some areas, in some other countries, they call it social registry or unified targeting database, but in our case, it is National Household Registry. The other one is program-based MICE. Different programs supposed to have their own MICs. So this MICE helps to retrieve data of the program from the database. The other one, the higher level, we will supposed to have the Central Social Protection Management Information System, which will be hosted at Ministry of Labor and Social Affairs. It will have high-level indicators, and we can see the social protection status of the nation. Next. Next, sorry. So, as an experience, we want to share you the Productive Safety Net program, but we have this is a rural one. We have also the Urban Productive Safety Net program. We selected this one because of the number of clients is too large, like 8 million. So Rural Productive Safety Net is Ethiopian's rural safety net for food insecure households, for both chronically and transitory food insecure households. It covers 8 regions, most of the regions, and it provides cash as well as food. Next. So the program contributes for the policy of government of Ethiopia in growth and transformation plan. It contributes on social protection policy, disaster risk management, national nutrition program, as well as climate resilience, green economy. Next. The program Around 8 million clients are benefiting from this program. 6% are conditional payment who contribute their labor for public work activities, and 40% are PDSs, permanent direct support, who are receiving their provision without any labor contribution. The good thing here, more than half percent of the clients is female. The program covers 8 regions and 350 districts. Next. So this is a map showing the area of the program intervention. So the colored part is the intervention area. Next. In terms of system development, digital social protection, we have been using a standalone system. We call it PASS, Payroll and Attendance Sheet System. It is having the main modules of social protection like registration, attendance, payroll, reconciliation, system audit, and reports. It's partially integrated with e-payment system. We have electronic payment. There are technology providers who work with our program. So there is a payment through, instead of cash payment, there is also a payment through the bank, electronic payment. The clients are not expected to receive cash in hand, but their benefits will be deposited in the bank. It covers a wide area of the country, and it has been tested for the last 10 years. But this standalone system has lots of limitation. One of the limitation is it's standalone. As a result, there is a distributed database which is difficult to manage. And also it has a limitation on addressing all the modules of social protection. It's only address, registration, attendance, and payment. No case management, grievance issue. So the other one, there is no standard national ID in this system. The major drawback of this system is absence of aggregated data information to bring aggregated data from lower level to the higher level. Next. So to enhance this system, we are developing the MIS, Integrated Management Information System. So it's designed to penetrate into 350 districts, and it will have a better performance in program efficiency. Next. So this MIS, it's a web application. The component architecture looks like this one. There is business models. So there are different modules like client management, which is registration. There is a targeting enrollment. There is public work management, direct support management. The direct support management will identify the type of the permanent direct support clients, their disability, and the linkage with the social service. It also has a graduation and exit module, livelihood, case management, and it will have also M&D and reporting system. Beside that, the system will share or integrate with other system. So it has API and will share client information, livelihood information, payment, fund, attendance, and some indicators in case management. So it will integrate with other system and will share informations of mentioned here. The other one, it will be, the database will be implemented at different level. At national level, there is a central database. In that regional level, we will have also a repository or a database. And at lower level, at district level also, we'll have a database. So the database architecture is in different level of the administrative hierarchy. Besides that, there is cross-cutting issues or non-functional requirements. So it will address the security, the scalability, the performance, the localization. It works with different local languages. By default, it works in English as well as the working language in Amharic, but at regional level, it works with the local language of the regions. So there is also testability, dependency, and synchronization of modules as well. Next. So on the architecture, at the national level, it's web-based, web portal. At regional level, it's also needs internet connectivity. It's also web-based. But at Warada level, at district level, it's offline, online functionality. Whenever there is no connectivity, it works offline and sync with the central system whenever it gets connectivity. So it has both functionality, and it works also at lower level, at county level, at Kabale level. We apply tablets. So the data collection in public work activity and the payment will be treated using tablets. We are piloting in some Kabalis, but there are issues on connectivity. But we have functionality up to district level. Next. So this is the layers. There is a database layer, the business layer, and the interface or presentation layer. So we have light application at lower level, which works offline, and which, as I said, it will sync with the central database. So at lower level, we have both. As long as we are having the light app, it works on both offline and online. Next. So the whole architecture looks like this. The central database will be at the national level, but still there is issue. We have a national data center, and we have also data center at different ministries. So this issue is still pending, where to host the system, because the program is owned, or there are different stakeholders. So they want to have their own data on their own data center. This is the issue, but there is a possibility of hosting at the center, or at the national data center or the ministry data center. And it will give provision for all users, including the development partners and different stakeholders through internet. At lower level, as I said, they have both functionality to do the basic modules of the system, like the registration, the client card management, the public work activities. These basic modules, the core modules of the program, works both offline and online. So there is cross-cutting issues as well, the security, the performance, the reliability, and the usability has been addressed. Next. I want to discuss responsibility of different ministries in terms of the platform arrangement. Next. So one of the platform for integrated system is a national ID. So the Ethiopian government is aggressively working on national ID. There are two ministries responsible on the national ID. One is Ministry of Innovation and Technology, who is responsible for it's not national ID, it's digital ID program. It's uniquely identify a person and ensure instant verification. It's just authentication and verification. Legal entities can facilitate citizens' access to social and political services. It is just to prove identity, not citizenship, the digital ID. The digital ID supposed to have only limited attributes of individual, like the full name, the mother name, place and date of birth, age, gender, and mobile number is optional, email address is optional, but it should capture the biometrics, the fingerprints, the two iris, 10 fingers, fingerprints, two iris, and facial photograph. But in the case of national ID, the Ministry of Peace is responsible on the development of the national ID, the provision of national ID. But the national ID will have longer attributes of a specific individual. So it's very sensitive, the national ID one, but the digital ID only having a limited attribute. So no one can identify a person's ethnic group or any political stand. So the national ID is associated with anything. But the digital ID doesn't associate with anything, but the national ID is a very sensitive one. So the government is working on both the national ID and the digital ID. Next. So on integrated social protection system, especially on digitizing the integrated social protection system, the issue, one is a national ID, the other one is a network infrastructure. So the government of Ethiopia has already connected the waradas, all waradas almost, and some zonal administration offices or regional administration offices, and at the federal level, it's centralized at a single ministry. It's Ministry of Innovation and Technology. But some other ministries will raise issues on this regard. They don't want to depend on a single ministry. This is the issue. So because of that, different ministries are moving away from the WaradaNet infrastructure, and they are creating their own infrastructure. So the school management information is having their own net, which is called SchoolNet. The HMIS is having also its own net. It's HealthNet. Agriculture is planning to have its own net, is AgriNet. Disaster Recovery Commission also is working on their own net, disaster recovery net. So we observe duplication of efforts in this regard. Next. The other issue is on the digitizing of social protection is hosting or data center. The government of Ethiopia has already built a national data center, but because of the management issue, the shortage of manpower, shortage of human resource, still each ministries are developing their own data center. So there are different data center in different ministries. So each ministries wants to have their own database on their own data center. This is the issue. It lacks the standardization of the integrated social protection system. So the government is pushing to host all the system in the national data center. So still the government is working on the improving, enhancing the national data center. Next. So having said this, I want to plug the challenge we faced so far. One of the challenges lack of or shortage of human resource on the IT area, but the opportunities different universities are producing youngsters in this profession, but they need training. So we have trainable human resource which is available, but currently there is shortage or lack of human resource. The other one is connectivity. Due to connectivity, especially connecting the lower level of administration to the central level, so it creates lack of data aggregation and real-time data management make it difficult. Power shortage is also unavailability, and access to power is also an issue. The other one, the unique ID, digital ID or the national ID is very important for the integrated social protection system. Because of the absence of this digital ID or national ID, it's unable to create standards across programs. The other issue, there is no personal data security policy. It's not yet approved by the parliament. So because of that, it's unable to share biometric data between different systems. There is also absence of data sharing policy. So integration of bank system with program-based DMIs, especially on transfer, there is a problem. There is also absence of data capturing standard, absence of data integration standard, absence of cloud computing policy. These are very critical issues. There is also high turnover of IT professionals in government offices. The other very critical issue is there is government restructuring. So the responsibility shifts from one ministry to another. So these are the issues that we want to share you, and we'll discuss through Q&A session. Thank you.
Thank you, Fikadu. I try one word I know, Amasakanala. I hope that was the right pronunciation. We couldn't see your camera the whole time. Maybe you can, or see you, no? You can try to put it on now that our participants know who we're talking to them or see you. So Tina, I also ask you to put on your camera so that we can go to the Q&A session. We have some questions which came in. So I cannot see you yet, both of you. Once again, thanks to both of you for these interesting insights. I would have expected even more questions because I think there was a lot of information. I guess questions will still come in, so please continue to post them. Ricardo, I guess you're having problems with your camera, which is a pity. So I would start with some questions to you, Tina. Maybe you could comment on, which was not a question, but more a contribution from Veronica Watzak from ILO on the fact that social protection systems are not only non-contributory, but also the contributory schemes. So not only for the poor, but also to prevent poverty and maintaining standard of living. And the delivery chain, so that's another comment from her, is only valid for non-contributory schemes and programs, not all programs. So this should be flagged, or maybe you could comment on that. What is the idea of World Bank approach on this? Should we start with that, or should I pose you more questions?
Yeah, let's do. Yeah, okay. Yeah, no, let's start with that. That's actually a really good starting point. And thanks, Veronica, for those comments. So one is on the question of poverty. Yes, absolutely. You know, of course, my bias is in poverty, as you might know. But if you think about the social registry is not just the bottom 40%. It can expand up to the 80% and beyond. And in fact, this is our advice to some of the countries as well, that as you go beyond the bottom 40%, if also because it helps with the inclusion-exclusion errors as well. So yeah, you're absolutely right. I think you know, if you heard it, it's my bias as to how we build these systems, that we build with the poorest in mind. And you know, in the whole design aspect of technology is that you don't build for the middle income people, or you don't build for the richest, but if you can build for the poorest and you can build for the extremes, if you would say, you know, you will tend to resolve some of those issues that would exclude them when they are interacting with those systems. So that's the perspective in which it was mentioned. On the social insurance, so this presentation is based on the source book on the foundations of SP delivery systems, and we had a lot of discussion about this, you know, because when we think about social protection, we have three major pillars. There's the social assistance, there's labor, and then there's the social insurance aspect. And so when we think about the delivery chain in theory should cover all of these different programs that are across these three pillars. But you're absolutely right, it does not cover some aspects of social insurance. We do deal with unemployment and disability insurance. So for instance, if you think about subsidized premiums for health insurance, you know, so we would be able to deal with some of those issues, but it does not address or discuss the contribution side of social insurance, because our focus is on how do you deliver rather than on the financing side. So yes, agreeing with you and also caveating some of these things. Did you want me to address some of the other questions, Alicia?
Sure. You want to pick them, or should I?
Yeah, I can go ahead and I can go ahead and pick them. I think I already saw some of them, so which were really good. So thank you so much. These are excellent comments, and these are exactly the sort of questions that we struggle with on a day-to-day basis as well. So you know, absolutely well received. Okay, so on building social registries in fragile states with fragmentation and limited capacity, that's also another really brilliant question about do you take a comprehensive approach that, you know, just goes big bang and looks at all the different programs, or do you build incrementally? And I think the answer is in your question, that is, you do build incrementally. And in many cases, you know, you'll see that probably it's not the government coming in and being able to do those sorts of proto or quasi-social registries to start with, but it's the humanitarian agencies who may have a lot of that data to start with that then increasingly starts to get integrated with the government once you get over the hump of weak government capacity. So there's a lot to unpack in there. It's not a simple answer, but there is definitely a whole stream of work around how do you build these in fragile settings as well as in settings that are adaptive, that require adaptive social protection approaches. I'm going to go to one of the other questions.
If I might suggest, just if FECADU also has contributions to some of these questions. I know they were more for Tina, but if
yes,
it is for Ethiopia also, please come in so that we don't repeat questions.
Would you please repeat the question?
So in terms of fragility, or how you what is the best approach of including programs and having one by one, or doing it all at once. So I think you already talked about that, but if you want to contribute more to this question. No.
Yeah, in our case, we prefer to go for different programs at a time instead of addressing one by one. So as I have shown in my presentation, there are different programs, and there are different program-based demises. So as a nation, we prefer to go for different programs at a time.
Yes, well, just to contribute to what FECADU said, I'm Getachew Birhanu from UNICEF, Social Protection Specialist. So we as Ethiopia agree to start from program-based social protection system, from social protection program-based, then we progressively we can move to the social registry. So the roadmap for us is to start from the program-based, one by one for each program.
Okay, thank you. Once again, it's a pity that we cannot see you. So if you want to continue trying to put your webcam on.
Sorry, we couldn't manage the camera. We have a problem on the camera. We are working on it. Sorry for inconvenience.
No, no problem. It's just a pity. So we might then continue with a question on the investments and in digital solutions from Tanya Osejo from World Food Programme. How investments in digital solutions have contributed to reduce error, fraud, and corruption. Maybe Tina, as an overall reflection first.
Great, thank you. I actually wanted to, I'm better reading this question from Veronica, and I want to read this out loud as well. I agree with her. This is, so this is based on the previous question, that social protection systems are not for the poor only, and it's important for framing. It's about preventing poverty and maintaining a standard of living when a life cycle risk occurs. Agree, absolutely, Veronica. So I've now better read this question. Okay, so coming to this question now on Tanya's question. Let me just go down to it to make sure I read it properly as well. So this is Tanya from WFP, is that correct? How investments in digital solutions have contributed to reduce error, fraud, and corruption? Is that correct?
Yes.
Okay, perfect. Okay, so a couple of different things, and I think there was also another question in terms of you know, what the social registry has contributed to in terms of inclusion and errors as well. So I'm going to link both of these questions and just say that there are a couple of we have a few numbers that I have on hand. One is that I think this number came from a few years ago in Pakistan. The social registry contributed to savings of about 248 million. In South Africa and Guinea, 157 million and 13 million respectively. In Argentina, with 34 social program databases, about $143 million in savings over an 8-year period. And I'm going to link that now to the error, fraud, and corruption question as well. Yes, it does contribute. So, you know, when we talk about these as investments and how they contribute to reducing error, fraud, and corruption, there's a really nice chart that one of our colleagues, Emil, has drawn about what is an error, what is fraud, what is corruption, which he regularly does at our core courses. You know, so are those inclusions deliberate or not? Are those all those inclusions or exclusions, were they not deliberate? Was it human error or was it administrator error, etc.? So going to the cost of error, fraud, and corruption, I'm just looking at some of the numbers over here. One of them is a case study from Moldova, and I believe that in 2015 they ran inspections on a random sample and revealed overpayment and underpayment in 64% of benefits cases that were received. So basically, what they were doing for EFC in Moldova was they had a team of about 5 people that did field-based checks of the benefits received by about 50,000 households across the country, and then they did those inspections to then look at overpayments, underpayments, and then develop risk profiles, etc., that allowed them to reduce those risks. I don't know if that answers your question, but you know, so it's all really interrelated. But there are different ways to go about it, would be my response.
Thank you, Tina. I would go on with 2 somehow related questions to Fekadu. So one is from Kennedy War, also from World Food Program. So he's asking if his understanding is correct that for the case of Ethiopia, the digital ID is a multi-purpose functional ID to access social governmental services. To what extent is the digital ID linked to the national ID? And the other question is coming from Dipankar Patnaik. So he is commenting that he's not sure if you heard probably that you said the government departments are going for individual frameworks. So I hope that he hopes that there is a thought process that there will be a future integration. Will the social ID be the unifier for these systems? So if you could reflect a little bit more on or around the unique identifier or foundational ID within the Ethiopian system, Fekadu.
Okay, I want to address the first question, the national ID and digital ID. The digital ID is only focusing on authentication of individual, but we can't trace the individual ethnic group and any characteristics or any other attributes of the individual. It's at the national level, but when you use it for any purpose, which we call it use cases. For example, if we want to use it for social protection, we just take the client's digital ID from the Ministry of Innovation and Technology. Then we add other additional attributes. So the initial point is supposed to be the digital ID. Then we go for the national ID based on the use case, whether we use it for education purpose or food security purpose or health purpose. But the initial point for the client for uniquely identify for authorization and authentication, we need to have the digital ID. But the attributes are very specific. So it is the responsibility of a specific program to add more attributes of the clients. This is the way the two IDs are related. But the national ID is having everything, all characteristics of the driving license, the passport, everything, all informations is there in the national ID. But the digital ID is only the biometric and the name of the individual. So it will capitalize in the program. That's how the two IDs are related. For the second question,
would you repeat, please, the second question?
Yes, sorry.
Yeah.
So the second question is around the integration, future integration of the different MIS and database and the different components of the integrated information system. So the question here is, will the social ID be the unifier for these systems, but it's more what ID will be the unique identifier or the foundational ID for the systems?
For the national ID, actually, as a integrated social protection system at a higher level, we are not concerned with the ID. In social protection system, we use the IDs at the lower level just to avoid fraud and corruption, because the person will be the only one to authorize and authenticate his payment. There are lots of grievance on payment, on targeting, but since we start the system, this corruption and the cases, the grievance and the complaints is reduced. So at higher level, we are not very much interested on identifying individual. At higher level, we just to see the high level indicators and the impact on social protection, on the contribution of different programs. But at the lower level, we use the digital ID, not the national ID for social protection.
Okay, thank you, Fekado. Maybe Tina, you could reflect a little bit on your experience or an overall evaluation of what other countries are doing. What is the experience? What are the challenges? Because I think this is one of the bottlenecks of a lot of systems, and also not only social protection, but cross-cutting into other sectors. How to link these systems.
Great, thank you. Yes, Alicia, and I want to support what Fekado and our colleague from UNICEF was saying as well, which is, you know, and we've struggled with this for a while in terms of making this clear distinction between a national ID and what we call a foundational ID or a digital, you know, it could be a digital, it could be, you know, different forms. Because the prevalent view, or let's say the norm that people understand, is that you have a country and then your identification credential comes from, it's a function of your nationality. But we know that the reality is that in the countries and in the places that we live in today, there are a lot of stateless people, there are refugees, there are people who have no way of proving their citizenship or nationality. And there is also an issue in terms of delivering services to individuals and them being unidentified. In fact, behind me is a poster for WURI, which is the 6-country regional operation that I run in West Africa, which is called the West Africa Unique Identification for Regional Integration and Inclusion. And we're building foundational ID platforms in 6 countries: Benin, Burkina Faso, Niger, Togo, Cote d'Ivoire, and Guinea, with the ECOWAS Commission, where each of them will have foundational ID platforms where anyone physically in the territory should be able to get this credential, this foundational ID credential, which we're calling a FID, and it should be regionally interoperable, which means that you can use that to facilitate opening up a bank account in any of the other ECOWAS countries. So I want to completely support what FECADU is saying. There is a need for us to go beyond this narrative of national IDs, because national IDs do not really help us from the service delivery perspective, because it excludes a lot of people who tend to be poor or marginalized, or just don't fall within the normative brackets. I hope that helps. I mean, there's a lot more around how these then promote interoperability and this whole of government approach, but then that's a whole other discussion to get into.
Thank you, Tina. Tina, as you were picking your questions before and I interrupted you a little bit, are there still questions you would like to prioritize?
So I think there was one question from Marvi Memon. I don't know if she's still on. And Marvi is the former Social Protection Minister from Pakistan, who I also have the honor of knowing. Hi, Marvi, if you're online. Thank you for your question. So I think the question here is, how can integrated social information systems be used to serve global value chains? So I think, if I understand correctly, because the question is really brief, is, when we talk about social registries as being for programs that are beyond social protection, are we also thinking about, for instance, agricultural value chains? So farmers and that whole group of smallholder farmers is also another group of individuals or families or households that might potentially be served by social registries. And agreed, it's also a potential user group, as I would call it, just as the health insurance, etc.
Thank you, Tina. I think, considering the time, I would come to maybe the last question to FECADU, and then ask both of you to get to your final conclusions, or what you still would like to say. FECADU, there is a question from Gabriel Fernandez from Liberia, on the connectivity challenges at Woreda level. So how are these addressed, and how often is data updated? And I think you talked about that, but I would also maybe ask you again about the different databases on local, regional, and national level, of how this is. Are these really different databases, or is this more in terms of facilitating the access? Because if these are different databases, how are these connected and synced regularly, or isn't there the need for that? Maybe you could explain a little bit further on that.
Okay. On connectivity issue, the government realized the importance of the connectivity issue as a platform for social protection. So the government is working aggressively, and it has been planned to enhance the Woreda net connectivity. So we hope we will have better connectivity. So it will be resolved. I hope the connectivity of lower front line implementers with the central database. So there will be improvement on connectivity. It is a backbone for data transfer and data sharing between the lower level and the higher level. So it's very basic. So the government already realized this issue. The databases, there are different databases at lower level. Each warada is having its own database, but the different districts database or data are aggregated and go for the higher level at zonal and regional level. So the data is coming for aggregation purpose, and it's also possible to see a single district information or data. But the issue is how to aggregate and see the information at the national level. So it's not different database. Each district is having their own database, and there will be data aggregation at the higher level. So they have access only for their own database at district level, and at regional level, the regions will have access for their own database only. But at the national level, there is a possibility of having or accessing each district data as well as aggregated data at regional or at the national level. That is the way how the database architecture is designed.
Thank you, Fekadu.
Sorry,
so,
on updating.
Yes.
Updating the database for specific modules like the payment. There is updates. They update it frequently, real-time updating, but the access for at the national level is quarterly. Every 3 months, there is a possibility of having a look the updated data quarterly. But the bigger data like targeting is updated annually. So different modules, there is different frequency of updating.
Thank you. This totally makes sense. Still would be very curious to get to know it on the ground. But we are running out of time. So Fekadu, Tina, any last words you would like to direct to our participants?
Just to say thank you for listening, and we look forward to more such interactions.
Thank you very much.
Okay, so thank you as our speakers today. It was very interesting and stimulating, and also the discussions, the questions which came from our participants. So the questions which haven't been answered will be answered afterwards and made available in the already mentioned online community. And so please stay tuned, connect to the community. And now when you close the window, there will be a survey following this webinar. So please also participate. And yes, thank you to socialprotection.org and IPCIG for organizing this webinar series, and stay tuned to the next session.
And thank you, Alicia, for moderating so beautifully.
Thank you. Welcome. Have a nice day to everybody. Bye.
Bye-bye. Bye-bye. Thank you.
Bye. Thank you.